Now the third part of hip bone, that is ischium bone. Ischium bone is one of the ventral component of hip. It forms the posterior-inferior part of hip bone and 2/5 portion of the acetabulum. It forms the posterior boundary of the obturator foramen. The external features, the ischium bone has body and the ramus. So first we discuss the body of ischium. The body of ischium, it is thick and massive mass of bone than the pubis. It lies below and behind to the acetabulum. It has two ends, upper end, lower end, three borders, anterior border, posterior border, and the lateral border, and three surfaces: femoral surface, dorsal surface, and pelvic surface. So first we discuss the two ends of body of ischium. The upper end of ischium, it forms the posterior-inferior 2/5 portion of the acetabulum, while the lower end of ischium, it forms the ischial tuberosity, and from this ischial tuberosity the ramus of ischium arises and it fuses with the inferior ramus of pubis and it forming the conjoined ischiopubic rami. Now borders. Anterior border. The anterior border of body of ischium, it forms the posterior margin of the obturator foramen. In this diagram, this is the obturator foramen, this is the posterior margin of obturator foramen, which is formed with the anterior border of the body of a ischium bone. So this is anterior border. The posterior border of the ischium, it goes upward and it continue with the posterior border of a ilium. Now this posterior border, its lower end, it end on the upper part of the ischial tuberosity. The posterior border of ischium, it has a one bony projection. So this bony projection known as ischial spine. Above this ischial spine, this is greater sciatic notch, and below this is the lesser sciatic notch. Now the lateral border. The lateral border of body of ischium, it is formed by the lateral margin of the ischial tuberosity. This is the lateral margin of ischial tuberosity, which form the lateral border of body of ischium. Now surfaces. Three surfaces. First, femoral surface. Femoral surface lies in between the anterior border and the lateral border of a body of ischium. This is pelvic surface. Pelvic surface, it is smooth and it forms the part of the lateral wall of a true pelvis. Dorsal surface. The dorsal surface of body of ischium, it continue above with the gluteal surface of a ilium. The dorsal surface of this ischium, it has three features. It has convex surface that adjoining with the acetabulum. Below it there is a wider shallow groove, and below this groove there is a upper part of ischial tuberosity is present. So three features: dorsal surface, convex surface, wider shallow groove, and the upper part of the ischial tuberosity. Now this ischial tuberosity, as we discussed that the ischial tuberosity, it is formed with the lower end of body of a ischium. So whole this ischial tuberosity, it is divided into two part, upper part and lower part. Now this upper part, it is again subdivided into supralateral area and inframedial area by a one oblique ridge, and the lower part it divided into outer area and a inner area by a one longitudinal line. So this is about the ischial tuberosity and its subdivision. Now attachment. Attachment on the pelvic surface of ischial spine, it gives origin to the posterior fibers of the levator ani muscle, and the margin of the ischial spine, it provides attachment to the sacrospinous ligament. Now conjoined ischiopubic rami. The inferior ramus of the pubis, it fuses with the ramus of ischium and it forming the conjoined ischiopubic rami. This ischiopubic rami has two borders and two surfaces. two borders, upper border and the lower border. So the upper border of ischiopubic rami, it forms the margin of the obturator foramen, while the lower border, it forms the pubic arch with the bone of opposite side. So this is lower border. It has two surfaces, inner surface and outer surface. So this is the outer rough surface, while the inner surface, it is convex and smooth, and this inner surface it divide into three area by two ridges. So this is the upper ridge and this is the lower ridge. So these two ridge divide the inner surface into three areas, the upper area, the intermediate area, and this is the lower area. Now attachment. The lower border of the ischiopubic rami, this is the lower border of ischiopubic rami. It provides attachment to the two structure, fascia lata and the Cullis fascia of perineum. So both these structures attach on the lower border of the ischiopubic rami. Now attachment on the inner surface of ischiopubic rami. So as we discussed that this inner surface, it is divided into three area, upper area, intermediate area and a lower area by two ridge. So suppose this is the upper ridge and this is the lower ridge. So these two ridge divide the inner surface into three area, upper, intermediate and lower. So this upper ridge, it gives attachment to the superior fascia of urogenital diaphragm, and this lower ridge, it gives attachment to the inferior fascia of urogenital diaphragm or perineal membrane. Now the upper area, this portion, the upper area, it provide origin to the obturator internus muscle. This intermediate area, it gives attachment to the two structures. Anteriorly, it gives origin to the sphincter urethrae, and behind it, it gives origin to the transverse perini profundus muscle. The lower area, this area gives attachment to the three structures, anterior to posterior, anterior most, this is crush of penis or clitoridis, behind it ischio-cavernous muscle, and behind it transverse perini superficialis muscle. So these are the attachment on the inner surface of ischiopubic rami. To summarize, the attachment on the inner surface of ischiopubic rami, including the upper margin and the lower margin of the ischiopubic rami. So above downward attachment. So the upper margin, this upper margin of ischiopubic rami, it gives attachment to the obturator membrane. Below obturator internus, below it superior fascia of urogenital diaphragm, below the intermediate area, it gives attachment to the sphincter urethrae anteriorly, and behind it transverse perini profundus. The lower ridge, it gives attachment to the inferior fascia of urogenital diaphragm or perineal membrane. The lower area, anteriorly crush of penis or clitoridis, behind it ischio-cavernous, and behind it transverse perini superficialis muscle. And the lower border, lower margin of this inner surface, it provides attachment to the fascia lata and the Cullis fascia of perineum. So these are the most important attachment on the inner surface, including upper margin and the lower margin of ischiopubic rami. So this is all about the hip bone regarding abdomen and pelvic region. So the important questions from this hip bone, that is differences between the male hip bone and the female hip bone. Thank you.